So now on this one now, we are going to visualize a follow-up of an ulcer, of a venous disorder. So for the follow-up of venous disorder, you have to follow up one, the disease. Is it clear? What is the clinical presentation? Is there a varicose vein that has reduced or not? That is the first presentation of the venous obstruction. Is there varicose veins that are reduced or not? If it has reduced, by what caliber and all that. And then the paraclinical, you visualize for the duplex ultrasound or the tismography or any other venography that you have done. You visualize if there is any anatomical disorder, if the dimension has reduced anatomically. Then you visualize for deep venous thrombosis by evaluating clinically for the calf tenderness, and paraclinically with the D-dimers to find if they are reducing or not. Is it clear? D-dimers are elements of fibrinolysis. So every time there is a thrombus, there must be fibrinolysis that occur, and the D-dimer is one of the products of fibrinolysis. Is it clear? So those are the things that you have to evaluate every day on your follow-up. And then see on the follow-up, you have to prevent the reoccurrence. And how do you prevent the reoccurrence? If the patient has a problem now with the primary venous insufficiency, you have to counsel him based on the problem of primary venous insufficiency. If the patient has a secondary venous insufficiency, you have to counsel him in order to prevent all the risk factors inside the VICOS triad. And if he cannot prevent, you have to do such a way that he has to control those risk factors. And if he has a risk factor, you have to place him on medication such as to prevent the hypercoagulation that is going to produce a thrombus. That is all the element on the follow-up. So in the follow-up, the first thing that you have to know is that it's divided in clinically and paraclinically when you are following up the patient in the hospital. And then you have to know that you have to follow up the patient out of the hospital. And to follow up the patient out of the hospital is by preventing the reoccurrence. Is it clear? You prevent the reoccurrence of the disease by following the patient out of the hospital, and you prevent the reoccurrence by knowing the risk factors. You have to prevent the risk factor or control the risk factors. So from here we are finished with the tutorial on venous obstruction and venous ulcer.